Yeah, it's still a celebration. Yeah, I just think.
A little after 9. All right, you're all set.
All right. So we'll go ahead and call the meeting to order and we will start with introductions. I am Elise Schweitzer, Chair of the Board, and I will go to my right, and go to Jan.
I'm Jan Lynch and I'm a member of the board, vice chair, yeah. And also on the mental health services board. Sheila McHenry, member of the board, and I'm on the TV subcommittee.
I'm Mary Hutchins, member of the board and on the health subcommittee.
Harmony Ayers Friedlander, deputy commissioner.
I'm Frank Krupa, Commissioner.
Corinne Plaza, the administrative assistant.
Ex-member.
Randy Brown, Tuscaloosa Legislature, and I was appointed to the board.
Jessica Connor, member of the mental health subcommittee and community service board.
And online?
Larry Roberts, member of the board and chair of the mental health subcommittee.
Okay, does anyone have any additions or deletions to the agenda? I am going to add a couple of items to the executive session that I made note of, and we'll discuss in the executive session. Okay, approval of minutes.
You can't.
We can't. We don't have quorum. Okay, well, we'll save it for the next meeting. Okay, oh, and speaking of the next meeting, Jan, I'm not in town, so you may have to facilitate the next meeting if you don't mind.
Sure.
Privilege of the floor, questions or comments? Okay. Any correspondence or announcements?
I think the only thing to announce is it May 13th,
May 10th.
May 10th? Are we talking about the same thing at the park?
No, we're talking about a different.
Okay, I think May 13th is the event at Stewart Park. For folks, so there won't be another board meeting between now and then. So if you're interested, I think it goes from like 11 to 4 or something like that. It's just a celebration of mental health in our community. I think it grew out of a recognition of Greg Ells initially, but is now kind of grown beyond that and still includes that, but is an event where there's going to be a lot of providers and activities and things in the community just celebrating mental health month. So that is May 13th. It's a Saturday.
Okay, chair's report. I don't really have much of a report, except to say that Harmony and I have had some discussions about how, and Harmony will probably mention this in her report, but how to move quickly to develop a plan that is now due June 30th, I think you said, for
The Oasis.
yeah, the state plan. And so the plan that we came up with is that we'll be meeting, we're going to go through committee chairs and have committee chairs do sort of some ad hoc meetings with us to try to pull that together. And if anyone would like to participate, of course, you're more than welcome. We were just trying to think of the quickest way to pull that together. So we'll be looking for feedback from all the committees on what goes into that plan. And maybe we'll get more detail about that from Harmony at some point. That's really all I can think of.
Sorry, Elise,
Yeah.
is that for the opioid settlement money or is that the broader?
No, yeah, so that's the, tell me the exact name of the actual.
Services.
Thank you.
Which changed from the 1 year to the 3 year, but they did not give us very much time. In fact, I just got another announcement today with the forms that we'll be using this year. So they're expecting that to be done in June. So we can ask for an extension if it makes sense. Like, let's say we have the plan put together, but we don't have a board meeting. So we can ask for an extension for, a good reason like that. So I don't think we have to be too worried about it, but it's not a lot of time.
So typically it's a 1 year plan, now it's a 2 year plan.
Oh, sorry. Say that again.
So typically it's a 1 year plan.
It was a one-year plan until this last year. They changed it to a three-year planning process. Because they got a lot of feedback on how a lot of these things you really can achieve in a year. But there had been some thought there'd be more time because it's a longer plan, but it really is still the same amount of time to do planning in.
So will your starting point be the one-year plan that you?
Yeah.
Is that available online?
I don't believe, it's not because this year, it used to be, but last year they changed the whole format. And OASIS is the state organization that's responsible for doing the planning. And they're updating all of their websites and all of their documentation. So it was literally something I uploaded to them, and then it just went away. And I never saw like a final, so what we have is what I typed in a form and sent to them, and it doesn't look like it ever got posted. But they're supposed to be fixing that this year. So we do have our plan, but it's not like on a formal site like it used to be.
So you're gonna be working on a three-year plan.
Yes.
And so there'll be like a mental health section, there'll be, how many?
Yeah, so usually the sections kind of roughly correlate to each subcommittee, so substance use, mental health, and developmental disabilities. But within that, there are goals, in each priority area, and there tends to be quite a bit of crossover. So for example, the past few years, we've had a workforce development goal around direct employment, direct support staff. And that crossed, sort of all areas. So I think we all kind of put our heads together in committees and then sort of filter it up. And some things are cross-cutting and some things are more specific to certain subcommittees.
When does the mental health committee meet?
Larry, when does the mental health committee meet?
Third Tuesday of the month at 1 o'clock, 1 to 2:30 via Zoom. And you're more than welcome to come. It's a pretty
1:30, is that what it was?
1 to 2:30.
1 to 2.
1 to 2:30, sorry.
Okay, thank you. Can I get an invite? Thank you, Karen.
Great. Okay, so that's it for me for now, and we can move on to Frank.
Two quick things. The county did announce the candidate that was successful for the homeless coordinator position. It's Tammy Baker. I'm sure most folks like Larry are familiar with. Tammy used to serve as community outreach worker on the Commons. She kind of launched that program when it was first started. And then I think most recently she was over helping to manage Art House since it opened, but now she'll be coming back to the county and taking over that role. So good news. She knows everybody. And so hopefully that'll help us kind of move some of those initiatives forward. So good news there. The opioid task force continues to meet. We'll be meeting again tomorrow. Our survey, I believe, is finally ready to go out, and a press release and the survey will be launched this week. We've got a draft RFP that will be reviewed tomorrow by the task force. Once that's finalized, then it goes over to the county to be processed. And we just found out today it could be as long as 3 weeks between when we give it to them and when they're able to actually get it posted. And then there'll likely be at least a 30-day time period for people to respond to it. So we're probably talking 2 months out before we'll actually have some proposals to review. And then I say this every month, but we're getting close with the pharmacy on the first floor. Construction has moving right along. Last week or 2 weeks ago, we were waiting on the cabinetry that has arrived and been installed. Now they're waiting on the IT for that to get installed, and they are interviewing staff. So we're hopeful that once they've identified staff and have a tentative open date, then we'll get some more information about how it's all going to work, and there'll be some conversation about how to get the word out about what they're doing. So getting close on that front as well. And that's all I had.
Any questions for Frank? Larry?
Couple days ago, I sent a Ithaca Voice article about a plan that a group of people presented to the legislature about how to approach homelessness. I'm wondering, Frank, what you know about this plan, and it sounds pretty solid, so I was wondering if we could get a presentation about what they're planning to do. It's been spearheaded by the Housing and Homeless Task Force.
Yeah, Liddy's coming next month to the board to present on what they've
Great.
done. So there'll be more of that. And also the city of Ithaca has a working plan as well that was presented to Common Council about their approach to the encampments. So that's floating around out there as well. I don't think any final decisions have been made yet, but the wheels are turning.
Can we ask somebody from the city to come and chat with us as well?
We can certainly ask, yep.
Cool, thanks.
Any other questions for Frank? All right, move on to Harmony.
So if you remember, we talked, and tell me if you don't hear me well enough, and I'll speak up. I tend to have a quieter voice. And I know we got a fan going on in here. A couple of months ago, we talked about the contracts. We did a summary of the first half of them. This is the second half. I'll try and not go into too much detail, but you have this report sent to you as well electronically. There are a couple of things. I'll just start with on the first page as a refresher, because we haven't looked at this in a while. There you see that there are 13 agencies in Tompkins County that have contracts that go through the LGU. And the first half, they're listed. And then today we'll do 7 through 13. The total amount of state money, so these are state dollars that flow through the county and with the expectation that we're providing some oversight to these funds, right? And making sure that they're meeting community needs. So you see the totals there for Office of Mental Health, it's $3,714,728. And for Oasis, it's $2,038,271. And then there's a smaller portion of county funding that's also spent that goes through this department, and that's $143,539. There are a number of requests as well from agencies that for over target requests, additional funding that agencies from time to time might ask of the county, and those are listed there in that report as well. So that's just every contract agency has, of course, a contract, and in it they have an outcome sheet, and we looked at that last time that they provide on a quarterly basis. So we're already in Q1 for 2023. It's hard to believe, but you still need to finalize what happened in 2022. So this is annual information, the final reports from 2022 that we received from people. So if you turn to page 7 in your packet, I'll just try and highlight a few things for you in it. We'll start with, I just called it part 2 because we did the other ones. Did you not get one?
Yeah, I guess I didn't realize that's what.
Are they all?
Yeah, there should be a full packet there.
Someone else didn't get one. I'm sorry, Tom, I didn't.
Tom's working. He's making you walk around.
It's so much easier if you have something to go along. And Larry, I think you have it sent electronically. So if you want to look at it electronically.
Okay, thanks.
There are a couple of trends I think you'll notice, especially in the second grouping of contracts. And that is 3 of the agencies we're going to review tonight said that they've seen an intensity of need, right? That comes out of SPOA, children's SPOA services, just really seeing an increased use and children, the severity. Everyone who works with children goes yes and yes. Also St. John's with the unhoused population, just the significant comorbidities of mental illness, substance use and sometimes developmental disabilities added on as well, just the complexity of need, the severity of need, and an increase from their perspective in overdoses. That's what they're seeing there. And then Cayuga Addiction and Recovery Services also describes, especially in their residential setting, that they're seeing an increase and just the severity of needs. A lot more people that are coming in with co-occurring mental health and substance use and pretty significant mental illness, along with their primary reason for their treatment there is for substance use, but they're coming in a lot of times with very serious mental illness as well. And that can be a challenging thing if you're not designed to serve that population at that level of need. So that's one trend that you'll see there. The other thing you'll notice is that every agency under barriers talks about the workforce. So this is all helpful information when we think about our local services plan for the next 3 years, like what are we hearing from our biggest providers in our community? Everyone has mentioned that there's a workforce challenges. Several have said, there's a reduction in services, right? So children's SPOA, like trying to get services for children can be really challenging if there's a service that exists, but they don't have the staff to actually provide the service. Our Lakeview partners have had to reduce their capacity and the housing for the community residents because they don't have enough staff. So that's another pretty significant trend that we gather from, I think, these reports.
We hear from everybody that there's no nurses, there's none of these professionals.
It's really hard. It's really hard from paraprofessionals to nursing staff to clinical staff. There's just such a major shortage right now. It's a field that's been really ignored for decades. It's been in the making.
Is there any program, I was reading, where was it? I think it was Minneapolis or maybe St. Paul, where they brought other retirees back and they offered incentives for retirees to come work that had been in these positions to work part-time. So they didn't upset their retirement or whatever it was. And they brought them in and then they would mentor also younger people because they had 30 years experience or whatever it was, because they just couldn't find anybody to work. So it's I'm sure if that's something we've thought about or not, but
I think people did a lot of that, especially, COVID was tough because retirees weren't necessarily interested in, and so it may be more something that can be done now. I know that there's a lot of effort being done by the State Office of People with Developmental Disabilities, OASIS, OMH. They're all coming up with these plans to try and improve educational opportunities for people, make more scholarships available, really encourage like BOCES programs to talk about these kinds of jobs. So it's like building, but it's going to be several years before we're going to see the fruit of that labor. So, any kind of strategy that people can find now.
Plus you lose all that knowledge.
Yeah.
Of people that have.
There's also like just people being exhausted, right? So people have just completely left the field.
Right.
And maybe some people decided with COVID, I'll just retire a few years early, right? There was a lot of fear about their health and that really made a lot of sense. So it's just a big struggle and there's everyone's experiencing it, right? Every sort of sector is experiencing it. So it's really tough times right now because it's not like you can necessarily encourage, there's too many people over in this sector, right? Maybe we can encourage them to apply for jobs here because everyone's feeling it. So
Has there been an increase in teletherapy, telehealth as a result of the staffing shortages?
well, I think there's telehealth because that's what people could do during COVID. And there were a lot of organizations, like when you think of clinicians, the opportunities they have to work in a lot of other settings, right? You can go work for a telehealth company. There are telehealth companies from like New York City that are paying higher rates. So it can actually create a lot of competition for local providers. And telehealth definitely has a place and it's always going to be here to stay. And now it's figuring out how to use telehealth when you can also come in person. What we notice in our clinic and our pros program is people want to be in person. A lot of times people, and if they're not, it's because there's some sort of barrier, childcare, transportation, there's some other issue because people really do often prefer to come in person and see people. So some of that telehealth has actually given people more job opportunities and sort of maybe fracture the field a little bit. So there's always pros and cons to everything, right?
Yeah.
So any other questions on just the basic trends? Not, we'll go right through. So it's the Alcohol and Drug Council. This hopefully will also help. Each of these gray boxes is a different kind of service that they provide. One of the things to highlight with Alcohol and Drug Council is that they provide a lot of prevention services. So Oasis has licensure and certification licensure process just for prevention programs. So there are a few in our county, and you'll see there how many hours of prevention services they provided. And then the next box is their early intervention services. And that is a little bit different. So the prevention services, they have community presentations, media campaigns. They call them environmental strategies. They're things like sticker shock is an example of an environmental strategy. You can go out and put stickers on beer containers at not usually a grocery store, but like one of those little places, maybe at a gas station or something where they have beer, and put stickers on them and remind people that alcohol is not for anyone under 21. So they do that sometimes right before a major event in the community, and trying to really make sure people have an awareness. Don't go buy alcohol for younger people and that sort of thing. What's the age? So that's one of their kind of environmental strategies they might use. And you can see the number of activities they provided for that. They did they anticipated doing about 12 and they did 33 and 22. So a lot more than they expected. Their early intervention services, that's the highest level of service and prevention for Oasis. So that's really designed for someone who is usually an adolescent or a young adult who is starting to use a substance. They haven't developed an addiction yet, but they're sort of dabbling with it. And it's a brief interventions that have been found to be really effective at reducing use further on. So it's still like a prevention strategy, but the person is using substances, but they can prevent, hopefully through engagement and activities with youth. Why, what's beneficial about using this drug, that sort of thing, to really think through what are they really trying to achieve, set some goals, and either youth reduce their use or decide they're not going to use at this point in time. So they're very successful. The Basics program is designed for college age youth. They used to have a lot of college students refer to them, and you'll see the numbers are not quite so promising for that program this year. Remember, kids were not necessarily on campus because of COVID. And also the colleges and Cornell University are starting to use other strategies on their campus. So they're going to really evaluate that program this next year to see if it's something to continue. But it does look like high schools are the high school here is going to probably use more teen intervene, which is the model. It's a brief number of sessions with the youth, and potentially if the child wants to and the family wants to, they can have a session together at the end. It's a really effective program. So hopefully we'll get to see more of that. And you can see some of the data for teen intervene. At least 79% developed a plan to reduce or abstain from use at the end of like 3 or 4 sessions.
Harmony, if they're just planning on engaging with Ithaca High School or other county high schools?
I believe it's just Ithaca High here. It just says Ithaca High School.
Okay.
Because other counties have teen intervene.
No, but obviously we have other high schools.
Other high schools. Yeah, that's the only one they may be doing it in other high schools, but that's one that they've been talking with. I believe they are also in other high schools.
Okay.
Yeah. And then under their outpatient clinic, so that's on the 5th floor right here, you can see the number of people that they served. There's a projected and then there's actual numbers there for you. And You'll see some of the projected numbers seem really off to the actual. Remember, this was the first really full year people did this process. So some of it was like a total guess and trying to figure out what they thought it would be. So I think those numbers will get better. And also, I think many our outpatient programs for substance use really struggled a little bit because it used to be like services were very strict. You would do all of these services in an outpatient setting. And now they've really moved to a different model where it's much more like, what do you want? What are your goals? It's much more personalized and individualized. So there has been a bit of a dip in people accessing the same number of services they might have a few years ago. So I think part of that's probably a learning curve for staff. Like, how do you engage people when you're using a different model, when it used to be, this is what you always get? And so hopefully the numbers back up there. Please stop if you read something. I just want to kind of briefly go through them. The open access detox and stabilization program. As you see, there was an over target request there for a total of $600,000 for that program over a 3-year period of time. So that's the amount that they have been getting support from over that period of time. There have been some delays. It looked great the whole year long until the fourth quarter. And then they needed some generator transfer switch that apparently was in a boat somewhere coming here. But it did finally come here. It looks like they have pretty much everything done physically. And now they're working on getting all the staffing, and they will be doing a ribbon cutting on May 10th. So hopefully that will be up and running soon. It's like we just talked about the workforce shortage. Imagine starting a new program where you need a lot of nursing and you need a lot of very specialized skills. So that's the struggle right now. Any questions on Alcohol and Drug Council?
Are they reporting difficulties staffing at this?
Yes,
Yep.
yes, it's tough to get all these new staff. Because to get that program up and running, there's a lot of new hires they need.
Right.
Because it's
Primarily
24/7
nurses,
nursing, yeah.
right? I mean, it's heavily nursing based and
Right.
they're probably the hardest professional to recruit at the moment.
So that May 10th date is pretty soft, right?
It's soft, yeah,
Okay.
yeah,
As of last week, there were 6 nurses short.
yeah, it's a lot.
As of last week, they were short 6 nurses.
Oh,
Maybe a bunch.
I do think they're going to open. I think the question will be how open, right? They probably aren't gonna open every bed day one, right? Just because of the staffing
Right.
issues, but I think they are planning to open.
I'm just curious in terms of salaries, are the salaries competitive for nurses in that field? Relative to, working in a hospital or a clinic or?
That's a big question. I think they're doing their best.
Mhm.
They have to stay within a payment model, right? Because they're only gonna get paid X amount per person they serve, per type of service, so they can't go crazy with what they're paying, but I do think they have upped the salaries to try to be more competitive. One of the biggest challenges in nursing right now is that because so much contract nursing has gone on, the nurse that was on staff is seeing the person next to them doing the same amount of work and getting twice as much pay and working half as much many days, right? And so they're leaving their staff jobs to go to the per diem places. And so it's kind of this snowball effect,
Yeah.
right? And you can't compete with the contracts because they're paying so much more. And that's really been a large part of the challenge with finding nurses right now is that was already kind of an issue pre-COVID, and then COVID just exploded it, right? Because everybody needed to have nurses, and if you're willing to travel or work different schedules, whatever it might be, it's a very lucrative option for folks. So I think that's part of what we're all battling against with the nursing shortage.
I had understood that they would be serving a number of counties. in that
Yeah.
Program.
Yeah.
How do you imagine that working for Tompkins County? Will it limit our access to the service or?
I don't think so, because it's so easy for people to get there from here. That tends to be the struggle with regional models, is the farther away you are from that setting, the harder it is for you to actually get transported there. So it tends to be, if you're the location of the regional program, probably the majority of the people coming are going to be from your area, because how far away are people going to be able to come for an open access program? So I think it will be definitely a benefit, because if other places are overwhelmed or don't have resources, they have a place to send somebody, but I don't think that would harm our local people. Any other questions about Alcohol and Drug Council? Gotta check on Larry. Okay. The next one is Community Addiction and Recovery Services. And you will see they start with their outcomes for their day treatment services. And then their outpatient program. And some of the highlights to point out here is that they in their day treatment program, they had a very good OASIS audit this year. They had very good complimentary remarks on that. They also received CARF accreditation, and anyone who's done a CARF accreditation knows that's a pretty nice thing to be able to say that you have. It's a standard of care that you have to provide to get that. And they have done a lot of work in restructuring their residential leadership and working to improve the types of the self-driven goals and improve clinical services. And then you'll see that they mentioned that one of their barriers is people are presenting with more complex and severe co-occurring needs. And then for their medically supervised outpatient program, you will see that they also saw they actually saw more people than they anticipated, but provided fewer services than they expected. So again, that's kind of learning this new model for agencies. And I think it's been a struggle for agencies to get all their survey data up and going. I know, of course, we used to do it in paper version, and then suddenly you're not doing it in paper version because no one's in your buildings and things like that. So hopefully we'll see improvement in survey collection, information on how people felt about the services, what people, the ideas about the quality of the service they got.
I'm just looking at the successful discharge, the out day treatment services projected 80%, actual 48%. Was the projection just up, unrealistically high, or are they dealing with, as you said, more complex and severe mental health issues?
I think it's a mixture of both. Yeah, but I think the complexity, and they also had a lot of staffing challenges as well. So there was turnover and they did some things around their leadership structure. So all of those things probably combined for maybe a higher level of people leaving against medical advice or things like that, not having a successful discharge. I think what we'll need is a few years of these, like keeping these outcome measures as consistent as possible, so that we're measuring the same things over a couple of years, and then we can start to see trends fit or not fit. And after COVID, it just feels like everything's kind of probably goofy this year anyway.
Is the definition of a successful discharge somebody that completed the whole program?
Yeah, a successful discharge would be someone completed as the program's going to be individualized. The length of the stay would be individualized to each person, and
Right.
What their needs were, and that they achieved the things in their treatment plan that they set out to achieve. It may be a percentage, like they didn't achieve everything, but they achieved some significant portion of it to be a successful discharge. So every agency has their own definitions of what success looks like, and I don't tell them how that measure should be, but we'll talk about it and make sure it makes sense. But a big struggle for programs like that is people just saying, I'm, just walking out the door and leaving, that sort of thing, or having behavioral episodes that might result in them not being able to stay there.
I see they put in here, Carriers, funding is not sufficient to sustain operations and offer competitive wages. It's basically the same story we're just talking about, but are they, is that a concern?
It's a concern. I think it's a concern. Like you see the state and all of these, it's all about the rates they get in reimbursement, right? And there's also money that they're getting from the state agencies to try. And so right now there have been a lot of supplemental funds that have gone to programs, residential programs in particular under COVID. Frank's better at speaking about this, but you couldn't have the same number of people.
Right.
And if you built a program based on having so many people in it, and now maybe you're half those people, it's pretty hard to make your revenue goals. And so it's just been a really, really challenging time, especially for residential programs that had to restrict the amount of people they could take in. And those rules have been in effect for a long period of time. So
Are they being eliminated soon?
The rules?
I mean, the rules on how many people you can have in because of COVID.
Oh, yeah, they're beyond that now.
Yeah.
Yeah, they're beyond that now, but early on it was like half,
Right.
right? So if you have 4 people sharing a bedroom, you can't do that anymore with
Right.
COVID, so it really hurt them. So I think that part is clearing out, but generally speaking, the payment structures were set up as Harmony was saying years ago, and things have changed dramatically in the last 3 years for everybody. So the acuity levels are higher. It can't be understated that the turnover issue isn't just about when you don't have someone in the position. When you bring someone in, day one, they're not taking on a caseload of 80 people. Right, so they have to be trained, brought up to speed. So you're paying while not bringing in revenue, right? That's even worse than not having it filled, because then at least you're not spending money on it, and all of those things aren't necessarily being accounted for, right, in the payment structures. And so much of the money is coming out for new services, right? We see the governor giving out money almost on a daily basis now, but it's much of it is for expanding new services without kind of shoring up the initial infrastructure of what was already there, which was struggling pre-COVID, and now has, only been exacerbated because of, what's going on in the marketplace right now. So there's a lot of factors that are building into being financially sustainable. We're facing it, right? As a mental health clinic, it's the same thing. I think probably every clinic out there of any type is struggling. And then throw in the telemedicine versus in person and trying to mix that together, and what you can bill for and what you can't bill for, and all the things that go along with that. There's just so many things impacting right now. And there hasn't really been a recognition that the rates need to reflect the change in the environment, at least in the short term.
and if you want to hire people, you have to hire people, right? So you're going to have to figure out how to pay them more. Yeah, it's just a really tough. And I think that point about here's the core services, and not much is happening for the core services. And new programming is great, but how are you going to staff it? That I think is going to be a challenge for a lot of the new things that are out there. A lot of people are saying we don't even have the capacity. We can't even apply for that. So they're great ideas, but you have to be in a stable place for people to be able to stretch themselves to try and get those funds.
Yeah, that can't be understated either, particularly for you, Randy, in the legislature, because you're seeing all these money opportunities being put out there. And I continually get emails from people. Are we looking at this? Are we looking at that? My head's spinning. To keep up with what the state's giving out, what the federal government's giving out. What are we qualified for? Can we actually we don't even have the capacity to read the documents to find out if we're eligible, because we're underwater with everything else. So I'm just putting that out there, and it's probably something I should be talking with HHS about as well, because I don't want anyone to think we're not trying, and by we I mean the collective universe of providers, that we're not trying to access those dollars whenever we can. But honestly, we just don't have the capacity to monitor it, let alone figure out if we're eligible, and then find a way to write a grant application, to access those dollars. So it's a really challenging environment, and it's frustrating too, because you see all that money out there and you're like, boy, we could really use that. But it's hard to really be able to navigate all of it and put together the requests when when you don't have the capacity.
Yeah, it's gonna be a while before we really understand what COVID did.
Oh, yeah.
You're seeing it, right?
Yeah,
But to really know how
yeah,
severe it is. And the schools are not seeing it.
sure. And there's huge amounts of unspent money, right? I mean, just on the school COVID side, not that this is pertinent to you all, but that we're gonna be giving back like $1.5 million because it came late in COVID. It was only designed for testing and things that we were past at that point, that we already had systems in place for, and or people weren't doing it to the same levels. I think the same thing is gonna happen with these follow-up dollars, is there's just the capacity to actually spend all of that money isn't there. And so I don't know where that money goes back to or what happens to it, but this is the boom and bust cycle that we've seen in public health forever. There's an issue, you get all kinds of money flooding the system for a couple of years, and then it all dries up, and then you go back to where you were before. But now there's all these new requirements on you that you're trying to address. And so that boom and bust cycle it's gonna bust in a couple of years. And we're gonna be back where we were, trying to figure out how we're gonna do all this stuff with new expectations.
Are these federal dollars, state dollars, or both?
It's mostly federal dollars coming through the state, right? From the giant bill that was passed. I don't remember what it's called. There were so many of them, but
Yeah.
yeah.
States just, their budget just approved a lot more mental health stuff too.
Of course, yeah, and they're using federal dollars to fill in those gaps, right?
I do think the initiatives that you all have undertaken in partnership with other counties and other organizations is really the direction things will need to continue to go in, you know, that the more collaboration that can go on across organizations, I think is going to be really key. You know, looking at the one grant that's going to be tried for in partnership with Cayuga Health Partners, I think is a really good model.
Yeah, and can't say enough about Cayuga Health Systems either, right? The fact that we have a local hospital system that's willing to work with us to partner to do all of these things. The state is heading on a path where those systems are going to go away. And there's just going to be giant ones in the big cities that then reach out and buy up everything else. We would not be where we were through COVID. We wouldn't be where we are post-COVID, well, post-acute COVID. Without Cayuga Health Systems' willingness to be a part of it. Now, they've got their own motives too for self-preservation and such, but that self-preservation is designed around being a part of our community and helping us meet the needs that we have here. So yeah, sorry, I get off my soapbox. I'm really worried about a couple of years from now and what this is all.
And I think you hear this in some of the responses for barriers, like, it's fine, they're giving us money today. But if these rates don't, if the fundamentals aren't there, if the rates do not match the costs, how long can agencies stay in business? So there needs to be some sort of acknowledgement that at the core, the business model is not working. And so saying, well, here's some extra dollars, hope you can keep staying along, you know, it's really hard and stressful for people to have to work under those kind of environment as well, right? Like, you can't really plan for your future if you're not sure if you're going to get this little kind of like bailout because the rates are so low. And we had many years of rates not being increased. So even though they have been increased recently, it doesn't make up for all of the year. You know, it'd be sticker shock if people saw what it really would have been if we'd had a modest increase every year to try and keep up with inflation. And then we had major inflation that just sort of eroded everything. So it's tough. It's tough. You see the state trying to address it as quickly as they can, but the economics don't make it easy for them either. If they're getting more rate increases and things that they have done, they're just not keeping up with the inflation everyone's experiencing. So
we're going to see it on the developmental disability side too, because the governor just they did not include an 11% increase for the early intervention providers, which we've been advocating for years. They haven't, it's been like a decade or so since they've seen an increase, and we don't have providers. So we have wait lists for kids. And so those kids that are getting waitlisted means that they're more likely to have more significant issues as they go through life. And that's going to evolve into other programs and services that are going to be needed later in life. So it's a very short-sighted approach to, the longer end game that we really should be looking at.
Well, when I look at funding and I'm trying to understand the counties, I'm getting a better handle on what it really is. But a lot of this funding comes from state, federal and state and comes down. How much county funding goes into these? I mean, it's our own money, not.
Yeah, sure.
Filters through us.
Yeah, it's a relatively small amount. I think it's like 150.
143 or
143,000. So the county has traditionally not put more than other counties, but generally counties have not put a lot of extra funding into these services because the expectation is the state should be funneling those dollars into it. Well, I mean, here we have seeded programs along the way. The legislature's been very generous when there's been gaps and we felt there was an important piece to plug those dollars in. But you know, the problem with that, Randy, that question is there's tug and pull, right? The state has tons of money right now, but they just took back the Medicaid holdback, right? To the tune of whatever that's going to be 600,000 this year and $1.5 million next year. Why? Right? Why? So
They think the counties have too much money.
so that's, yeah, I mean, that's,
They think the counties have too much fund balance.
so that's
They
the,
just figure, well, you can use your own money.
yeah, when you look at,
That's what it is.
and when you look at the big picture, then, you know, it's hard to, you get in this tug and pull about who should pay and who shouldn't, right? And
But you can fight all day over that. Meanwhile, it doesn't get fixed.
I agree.
Well, I think this is a really important conversation, but it might have to be continued because I have to go into executive session.
Not a rabbit hole.
But no, it's very interesting and important. Thanks.
do you want me to just like do a quick on the next, how much time do I have?
I mean, you have about 20 minutes until we go into executive session. So if you want to try to just hit the high points of the remaining agencies and see, we'll get through.
Quorum for executive?
We're not we can't vote, but we can still have a discussion, which I think we should do. So,
Okay, keep me on task, Elise. I know.
okay.
All right.
Now stop.
It's something people are passionate about, right? You can tell when it's something people are passionate about. So Lakeview Health Services is the next one, and you'll see that they provide, the first one there, it might be a little confusing. You're saying they serve two people. What is that about? And that's really about, they provide care management services for people who do not have Medicaid. So when the state created care management agencies, they looked at agencies that were the previous providers in the community and made them legacy providers, and they are designed, they're entitled to do extra services. So one of them is, and this is like an odd duck because here's like a service we would like to support more people with, and it may be an issue of the community not being aware that this is a service that they provide. And so they're hoping to find ways to expand access to care management and high intensity care management services for people without Medicaid. The next program that's described there is their service, what do they call them? Service dollars. And so basically how to explain these dollars is people that get services through Lakeview, if they need additional items, like maybe an emergency kind of situation, like this person just moved in, literally doesn't have any furniture, right? But because it's the funding of last resort, oftentimes this pool of dollars is there. It's about $100,000 and they spend maybe $20,000 during the year. And so I question that, like, why aren't you spending all of these dollars? People must have needs. And they say, well, there's so much red tape to these dollars. You really have to prove you've used every other dollar available. And most of the time we can find other funding, but it's there every year, like an emergency bank of dollars that they have. So they're working on creating a social determinant scale because we know that these dollars are being used to help with specific things around housing, education, other needs that people have, and that it does impact the quality of their life and their stabilization. So they're working on how to better measure that. The other program that they have there is their community residence SRO. And here it's just sad. It goes to the challenges with workforce that they projected to serve 44. They know how many people they serve in a year. That's not a guess to them, right? And it's under that because they have had to reduce the amount of people. They've had to put a hold on their beds because of staffing problems. They're also to create an awareness. Again, a unique need is that they're having people aging in place So many of the people that are getting those services have had them for many years. And now they're having clients who are also struggling with things like dementia, along with their severe mental illness, and trying to get someone moved maybe into another kind of setting can be very, very challenging to do. So their staff are addressing multiple health problems, other kinds of things that you might expect with older age in their facility. And then you'll see their supportive housing program, and they actually served more than they anticipated in that program. So that's some good news. You'll notice they did provide some information on their survey data, but the numbers are really so small. This last year, I think people have to get organized again to get more survey data so we can really see if it's meaningful or not. Mental Health Association, they have a number of really wonderful programs that are peer oriented for people. So the first one you see is their new outreach center, and you'll remember that because we did review that and approve that. And then that went to the legislature to provide some funding support for them to create the outreach center on the Commons. And you'll see that they served, they anticipated with that new outreach center to serve 200 people. They served 265. Their attendance in Q3 went from 37 people to 128 in the fourth quarter. So it is really an invaluable program to the community. And then when they survey people about the services they're getting from them, people are very, very satisfied. And then their other program they have there is their peer support and adult advocacy services. And they served 646 people this year. And you can see the number of hours. When it says direct and indirect, what that means is a direct hours. I spent it with you providing a service directly to you. Indirect might be I did some case management. I did something on your behalf in support of you. Maybe I organized some activity or something like that, or I had to write my notes, but they're all indirect services that are beneficial to that person. And they've done a lot of training on mental health first aid. They've done wellness training they've worked in high schools. They've worked there. You see, I gave an example of the human resources and management staff. And they've also got a warm health. We now have 2 warm lines in our community. So that's fabulous. I think it's great when people have choice. The warm line for Mental Health Association is not 24/7 like the one is for suicide prevention and crisis services. But they do have a warm line there, and they've seen an increased use of that. So that's really positive. And they've gotten 2 new evidence-based programs that they've trained their staff in. And they also have their community-based peer support services. They changed the name to Justice Support Services. They've worked now with OAR, probation day reporting, and the Ithaca Wellness and Recovery Court, and they're providing peer services at all of those locations. And they're seeing that people who are getting services through those agencies are now also coming in to their center, their outreach center. So they're getting even more services there because the outreach center has different agencies come and provide information using their space. So if people want work support, or you've probably had people there, Jan, I don't know, the Mental Health Association, but they ask, they have other agencies come and like do a really nice warm handoff or just educational support about other things available in the community there. So it's great to see that some of the people most in need are getting that peer support through them. And they have their family peer support services. And next year, they're going to be working on developing weekly parent support group and youth drop-in programming. I really am excited about that as a possibility that there'll be times that will just be family and kids centered at the center as well. So all ages will have support at different times.
Harmony, do we know, do they have a hired staff? My understanding was that they did not currently have any like youth peer advocate.
I think that individual got a promotion, right? And they're still, as of today, I heard that they're still looking to try and fill that position.
Okay, so not yet. Okay.
Yeah. And then suicide prevention and crisis services, you've heard a lot from Tiffany. She came and spoke with us, so you'll see some of the achievements there. And you also received a new document that she's sending out now every quarter. Are you all interested in getting that? Because we can make sure you get that. Okay. Yeah, they've done such an amazing job here with 988 and getting that warm line up and doing a lot of support for people. So I think it'll be interesting to see some of the other activities they get started. St. John's Community Services, so they provide services to the unhoused. I want you to just take a look at some of these numbers of the number of unduplicated. It's hard for them all. And so we had to be creative to try and figure out how to measure. They're trying to get a system where everyone sort of gets a key code so they can do a better job of counting people. But 1,239 unduplicated people were served at their Friendship Center, and then people that are coming in and getting more services was this other number. And then it was easier to count food that they're providing to people at the Friendship Center. So you can see how many meals, over 6,000. And they're serving anywhere between in each quarter, 133 to 232 people with meals every quarter. And the need just grows. So the last one is Racker, and their local service planning goal areas and prevention. And they provide care management services to children. And you'll see, again, they're divided by Medicaid and non-Medicaid. And you'll see that they served over more than they anticipated children this year, like 36 with a projection of 20. And these are hard numbers. They know how many youth they typically provide care coordination services to. And a total of 144 children received their services. And then their day treatment services. So they projected serving 75 children in day treatment this year, and they only served 59. And the reason for that reduction was both, again, staffing, but it also involves teaching staff. So when you don't have teaching staff, even if you have the clinician staff positions filled, you still can't have those children come to the school. So they have gotten things pretty stabilized with the clinician staffing, and they talk in here about how it's not obviously great for children to have different providers, middle of the year, but they are pretty stabilized there. And it was really the teaching staff that was making it challenging for them to serve the number they anticipated this year. So hopefully better next year. And then children's SPOA, 174 people were served and 216 connections made. And the SPOA coordinator is involved in multiple initiatives, including coordinating the Suicide Prevention Coalition. And she's on a statewide task force. So they did a lot of changing to children's services. And they really kind of removed SPOA, which is sort of like the traffic cops for services for children and adults, right? And they removed them from a lot of the Department of Health services. And they kind of went in their own little bucket, and SPOA didn't really ever know about them. And now Department of Health came to a conference meeting and said, we now know that was a mistake. Got to give people credit when they acknowledge that was a mistake. And they're working hard on figuring out how to better integrate. So all of the services will flow through there, and that they'll really use this centralized hub, which is what SPOA is, to really make sure we rapidly get services wrapped around as much as possible to children. We are hoping, they did just announce a Children's Act RFP for our community, and a home-based crisis services RFP have been announced, and we hope to be applying for both of those. So hopefully we'll get more intensive home-based services for children.
Are those the ones that are going to be housed within Racker?
The ACT program is just hot off the presses, and that will be a combined regional with Tioga County. So we're working with Tioga County. We're meeting with County this Wednesday.
And Sally,
But we have some agencies already interested. So that was the biggest thing. Jean Sidoti from Office of Mental Health was saying, well, we're gonna put it out and maybe we hope you find someone who wants to do it because of staffing. There have been times where they've put these RFPs out and people have not been able to find a provider to do the services. And the home-based crisis services is the one that's the grant that's coming through our system of care with Racker.
Okay.
I think,
So Sally Manning's up.
Sal, yeah.
Beautiful. As long as Sally's everywhere.
You're on all of those committees anyway, so you could just give the children's report. So that is it. Any questions? How'd I do?
See, I think you did very well.
I have one,
6:39.
I have one question because I don't know how it works. So what does the Community Mental Health Services Board do? Do they look at these service providers and how does, what is your role here with?
Go ahead.
So they're essentially approving where the state dollars are going, right? So the local services plan is step one. That's supposed to identify the areas of need. And then any new state dollars or new initiatives should be focused towards those needs. The existing money are going to established agencies for particular services that those monies are designed for. So years and years ago, there were RFPs that were done for all. I'm going to assume years and years ago, there were RFPs that were done that kind of signed these dollars to these different organizations. So now you're kind of in the Community Service Board is in the role of reviewing, making sure those agencies are doing what they should be doing with those dollars.
And see the numbers.
Yeah, and if there's something that you feel like an agency is underperforming or overperforming, and you want us to look at shifting dollars around, I mean, we can always do that, but they're very tightly controlled by the state about where they should go. And, we had even had thoughts pre-Harmony about re-RFPing everything just because it had been so long. And the state pretty much said, don't do that. Because there are established agencies that the uncertainty, we've talked about how much, it would create uncertainty for those already fragile agencies in your community as well. So they cautioned against it. So generally speaking, the Community Services Board does have responsibility for overseeing the state dollars that come to the county for these services. And right now, the role is really reviewing the agencies that are getting those dollars and what they're doing with them and ensuring that it's the appropriate place for those resources to be allocated.
I think one thing that would be helpful moving forward is, and I think we've seen this somewhere else, because I think there was another document that had the dollar amounts attached to every agency that you had shared at one point. Just moving forward, I know a lot of agencies were still, able to say, well, COVID restrictions and different limitations made 2022 data not reflective of what would normally have been. But I think that by 2023, we should be able to see where, if there are still agencies, like there was some significant underperformance here. And part of that is, as you said, they're self-targeting, right? So if they're developing their own targets now, next time they probably won't set those same targets. So they'll look better no matter what. But maybe it's not a matter of whether or not you don't allocate the money to them anymore, but it may be a dialogue about, well, you've allocated it to this type of service and the community doesn't seem to want this type of service, or, how can we, so maybe next year we could look a little more closely at that.
Harmony's been having those conversations in building this.
Yeah.
Right. She sat down with every one of the agencies and said, hey, what are you spending this money on? You need to start telling us. And then she's had some of those difficult conversations and we've proposed moving some dollars around to different places.
But it's not easy.
No.
Yeah.
And we got to get the state approval to consider it. And they actually have shot down a couple of ideas that Harmony and others have come up with. So, you have all the power in the world until you ask.
Yeah, well, and part of it is just, I think sometimes if you just make agencies come to this meeting and talk about how they're spending those dollars themselves, then they will do a better job of accounting for them and get better results maybe.
This format is such an improvement.
Yes.
All I know is words, so don't ask me to do anything other than.
Well, I think it's I like it. It's good.
I like the format too.
Larry, did you have a question?
Yeah, so I just had a comment. One is, I think it would be good for the board and the subcommittees to really talk about what's our vision for serving people with more complex needs? And what are we doing to make sure we're helping to equip the agencies to do that? Is it training? Is it resources? Is it programming? Because I'm not surprised that people are coming to agencies with more complex needs, but we need to be able to meet them when they come.
Yeah, and Larry, I think that could be a good part of the discussion that we have regarding the local services plan as well.
Yes, yes.
Any other questions for Harmony?
Thank you. The data is great. Good. Really, really good. I know we've been asking for data for a long time and it's really great. to Really get some data.
Yeah, you're the contract wrangler. He pulled it all together. That's great. All right. So I think we're going to go into executive session. Tom, it was really nice having you with us tonight. Would you like some assistance with your gifts? You've got an armload of gifts there.
Pockets in my coat.
Okay.
Well, thank you, Tom. Yes.
It's tough, you know, operate with one of these stupid